Okay, so we are going to be doing an ear, nose and throat exam for you today. How are you feeling? Good. Okay, so first of all, what we'll do is I'm just going to check the quality of your hearing on both sides. So what I'll get you to do is, if I get you to shut your eyes for me, and if I get you to raise your hand on the side that you hear my fingers. So if you could shut your eyes, there you go, good. And raise your hand. Perfect, good. And can you shut your eyes again for me? And raise your hand. Okay, good. Keep your eyes shut and raise your hand. Perfect. And once more, if you can raise your hand for me. Yeah, that's good. All right, that's fine. So what we're going to do next is we're just going to check the integrity of your ears. So I'm just going to be checking the cartilage on each side as we go, and checking for any signs of flakiness or redness. Okay, good. Now what I'm going to do next is I'm just going to reach behind the ear on this side, and I'm going to press on the mastoid process just to check for any tenderness on this side. So if I press in just behind the ear, can you tell me, do you feel any pain or discomfort? No? All right, that's good. So I'm going to press in now just about here. We're going to check for some tragal tenderness on that one side. All right, so if I have a press around on that side and you tell me whether you feel any pain or tenderness. No? Perfect. All right, that's good. So we're going to do exactly the same on the other side now. So I'm just going to check first of all any signs of redness or infection. And what we're checking for is checking the cartilage of the ear. And we're checking for any battle signs or ecchymosis on this one side. Okay, that is good. Perfect. Okay, and again, I'm just going to reach just behind the ear on this one side. And you tell me if I press and have a feel around the mastoid process just behind your left ear, and tell me if you feel any pain or discomfort. No? Excellent, good. We'll check the tragal area. So again, same thing, and I'm just going to press on the tragus, and you tell me if you feel any pain or discomfort. That's good. Okay. How are you feeling? So far, so good? That's great. Okay, so just give the ears just a little bit more of a palpation rather. Keep getting those two words mixed up. On each side. and you tell me if you feel any pain, discomfort, tingles. That, my friend, is perfect. Okay, so what we're going to do next is we're going to have a look inside your ears with this little guy here. Now this is an Osteoscope, and this is going to show me the ear canal, the middle ear, and the tympanic membrane. So let's just have a look-see. So if I get you to, let's look ahead for me now. This is going to be a little bit cold on either side because it's metal. You can feel the cold, yes? Okay, good. If you can, let's turn your head a little bit this way for me. Good. Alrighty. And let's just have a look inside. Okay, so landmarks are perfectly clear. Cone of light is perfectly clear. And the middle ear, there is no sign of any fluid or redness. And looking at the tympanic membrane, that is intact and good to go. Okay, so a few flakes kind of floating around, but nothing there that is untoward. Okay, that's cool. So I'm going to do exactly the same with the other side, so if you can turn your head just a little bit, so you're looking somewhere over there for me, and let's just have a look-see. Okay, that's good. Yeah, sorry, it's a little bit on the cold side. Okay, so ear canal, perfectly clear, no fluid, no redness, and no edema. Okay, tympanic membrane is intact and in perfect condition. Okay, good. That's fine. 10 out of 10. You are doing well, my friend. So, let's just have a look on either side. Okay. How are you holding up? Good. All right, that's fine. So, let's see what the next test brings. So, here is a tuning fork. Now what I'm going to do is, I'm going to pop this on top of your head, okay? And I want you to tell me whether the vibrational sound that you hear in either ear is roughly equal on either side. So, about equal on either side. Perfect, good. Okay, so what we'll do now is on each side, we're going to check your bone conduction and air conduction. Now the bone conduction, I just need to pop this right against the mastoid area on the one side. So there you go. And tell me when the sound goes away. Perfect. Good. Okay, we'll just check the air conduction. So, again, you'll hear the vibration. Tell me when you don't hear it anymore. Okay, so. That is perfect, good. So we should have a ratio of about 2 to 1 air conduction to bone conduction. So that is perfect, that's great. So I'm going to do exactly the same on the other side. Just going to pop this up against the back of your ear here. So again, oops, try again. Okay, and tell me when you can't hear the vibration anymore. Right about now? Good, okay. So we'll try your air conduction. So again, same thing on this side, and tell me when you don't hear it anymore. Okay, we're just going to do that again. Good. That's fine. Yes, okay, so that is perfect. So we have a ratio of about 2 to 1 on either side, so your ears are absolutely perfect. Good for you. All right, so what we're going to do next is we're going to check out your nose. So what I'll get you to do is if you can tilt your head back just a little bit for me, and I'm just going to have a look up inside your nose to begin with. And okay, sorry, this is a little bit uncomfortable, but the mucosa is nice and pink. Yes, good. There is no septal deviation, which is excellent, and the terminates are fine. Okay, good, just have a breather. That's great, good. So tilt your head back again for me. Okay, good. No edema, no redness, no flakiness, no sign of infection. Okay, that's good. So I'm just going to observe now the appearance of your nose. So I'm just going to have a look-see, and yeah, there's no deformity. Everything seems symmetrical. The skin looks good. So I'm just going to palpate the bone at the top here. Perfect. All right. And I'm going to now palpate the cartilage on either side of your nose. And what I'm doing is I'm feeling for any lumps or bumps or abnormalities on either side. Yeah. Yeah, that is perfect. Good for you. Okay, so I'm just going to have another look at this guy again. Just up your nose. So if you can tilt your head back, and this gives me just a more in-depth look at what's going on. So, there we go. And there are no lesions, no polyps. All right, good. That is perfect. So let's have a look now at the other side. If you want to just give your neck a bit of a crick. And if you look up again for me, and there you go, good. All right, and Same thing. No lesions. No polyps that I can see. Okay, good. That, my friend, is perfect. Okay, you may be able to hear my dog snoring. It's very unprofessional, I know, having a dog in a doctor's office. But he's a Chihuahua, and he's very clean, and I had him disinfected before he went to sleep, so there's no chance of catching any germs or anything. And hearing him snore, sometimes relaxes you a little bit, so it makes the test a little bit less scary. I hope so anyway. So what I'll get you to do next is, if you can plug up one nostril for me, there you go, just on this side, and I'd like you to inhale. Yes, good for you. I'm going to do the other on the other side, so if you can plug one nostril for me and inhale. Yes, good for you. All right, that's fine. So, nose is looking good. So, what we'll do next is I'm just going to get you to tell me, we're going to do a smell test. So I'm going to bring this up to your nostril, and I'd like you to plug the one side for me, please, and tell me what this smell is. Peppermint, good, that's fine. And we shall do the other side, so if you can plug your nostril again for me and tell me what this smell is. Citrus, yeah, grapefruit. That's cool. All right, that's fine. So, ears are good. Nose is excellent. So what we'll do next is we'll have a look around the mouth cavity, and we'll check also your throat. So what I'd like you to do is open wide for me, and I'm just going to shine this light in your eyes just to have a look at your mouth cavity, just to see what's going on. Okay, good. Smile for me. Well, smile. If you can kind of show your teeth, bare your teeth for me like this. So yeah, good. So teeth are all white and even. No sign of distress on the teeth at all. Now, I'm just going to pull down your lower lip like this. So I'm just going to pull that down just to check out the gums and the gingiva. Okay, good. Now, observing your lips from the outside, they look symmetrical. You haven't had Botox done, have you? No, I didn't think so. Good. And no flakiness. Everything seems to be fine. No edema, no lesions, no cuts or anything. So they're looking good. So I'm just going to lift up now your upper lip, and just going to check the gingiva and your gums along the top, and we're going to check the frenulum. Just have a look with the light. So just lift up your upper lip. Yeah, frenulum is intact. Good. All right, that's fine. Good. Okay, so let's just have a look now a little bit further down your mouth cavity. So use this guy here. Don't worry, it's not going all the way down your throat. So I'm just going to get you to open wide for me. That's good. And if you can say ah, yeah, that's good. So say ah again for me. Yeah, see the soft palate elevates symmetrically, so that's looking good. And when did you have your tonsils out? 11 years old? Okay, that's great. Okay, good. All right, you don't need to say ah anymore, but ah if you can keep your mouth open for me. And I'm just going to have just look around just to check that the integrity of the mouth cavity is as it should be. Okay, good. Now, if you could lift your tongue up for me. There you go. So lift your tongue up. Frenulum is good. And everything is intact. Okay, that's excellent. Good. You can close your mouth now. So what I'm going to do next is I'm just going to have a feel around at the tissue inside your mouth just to check that everything is good to go. It looks fine, but sometimes when you have a good feel, you can feel any discrete lumps or bumps that shouldn't be there. So again, it's going to be a little bit uncomfortable, but if you open your mouth for me, and we're just going to have a feel on this one side. Okay. Just having a feel of the buccal membrane. And that feels nice and intact. Okay, good. So I'm going to do the same on the other side. So if you have a swallow, all right, that's good. So again, if you open your mouth for me and just have a feel around on the inside. Buccal membrane is good to go. And the gingiva is looking good. All right, that's fine. Good. So, if you can, once I get this depressive stick out of its packet, there we go. So, what I'd like you to do is, if you could say "ah" for me, and again, and once more. Yeah, perfect. Okay, so I'm just going to have a look a little bit further down your throat. So what I need to do is, I need to pop this thing on. And what this does is it gives me a good look at what's going on at the back of your throat. And it's handy if I need to take a bike ride home at the end of the clinic. So if I get you to open nice and wide for me, and let's see what's going on. Okay. And if you can say "ah" again for me, and just once more. Good. And once more. That's great. Okay. You did fantastically. Oops. You did very well. And everything is nice and healthy. Ears are working well. On either side, perfectly equally fine. Your mouth cavity, perfectly healthy. Hygiene is brilliant and on point. And your throat is looking very healthy. Nice pink, no lesions, nothing there to worry about. And your nose is nice and clear, no polyps, no lumps, bumps or anything, nothing to be worried about at all. So, you did good. And what we will do is, we will have you back the next time. So, but if you have any problems between now and then, of course, come back in. And if you enjoyed this examination, what I'd like you to do is over here there is a subscribe button, and I'd like you just to give that a punch if you wouldn't mind. So we'll see you again next time. Good to see you.